sure that all the people who are here, they basically do understand what does a clinical job means. And let's put it in a very simple manner, where there's a direct interference of a healthcare professional with a patient, a living patient, that would be a clinical. Anyone else who are not, they will be non-clinical. So such as the doctors, nurses, okay, the pharmacists who are taking care of the patients, okay, like the PharmD grads. So they all will be coming under the clinical part, and all the people who are not involved in the direct interference with the patients would be uh, the non-clinical. Okay, so I just would like to share a screen here, and if it's visible, if just can someone help me out? Is that
Yes,
screen?
yes, it's visible,
Yes,
Vishi.
it
Yeah.
is visible.
So Dr. Satish, whatever, it's always been my favorite slide. Okay, so if you look at the
Mhm.
entire healthcare ecosystem, it revolves around the patients being in the middle. That's me, you, or anyone. Okay, and if you look at, okay, we have been the regulatory bodies are there, your public health, the research and education, hospital, healthcare providers. There are again the providers, the doctors, the medical tourism, medical product, life sciences, genomics, diagnostics, wellness, venture capitalists who are the funding the projects, okay, the distribution network, pharma, payers are basically the insurance company, healthcare IT, e-learning. I'm sure that many of you maybe again keep thinking. So that's how the entire ecosystem looks to be. So if you look at this entire ecosystem, the majority of the ecosystem is running because of a non-clinical support of the healthcare professionals. Okay, so regulatory bodies, okay, those people who are involved in the clinical trials directly there, maybe among the clinical side. But if you look at the 90% or 80%, it's all about the compliance regulation aspect of it. Public health, okay, it's more about making sure the adherence of the various uh, adoption of the public policies and the public health being there. So likewise, this particular slide would help to build the context that how large is this particular, the non-clinical aspects of it. Okay. So with this, Dr. Satish, I would say like, you can add it on. That would be my knowledge with respect to non-clinical aspect of it.
Thanks, Vishi. I think it's a wonderful infographic, where everything is, very clearly put. And what I like the most is the patient is at the center of everything. So it again emphasizes the fact that the patient is the center of the healthcare system. You rightly said me, you, and all of us. So it can be anyone over there. So just to start with, just to differentiate between clinical and non-clinical, I'm talking in terms of I'm giving a perspective in terms of scope and also the value and recognition. When a doctor is on an operating table, when he's going to make an incision, apart from that incision and procedure, the rest of everything is a non-clinical job. So it says that prior to the practice, prior to the doctor starting a procedure, and even after ending, and further care at home or at whatever it is, remote care or whatever, the entire non-clinical ecosystem is involved. So there is a lot of importance on this roles. So one important thing I wanted to state here is there is a lot of transition happening wherein the clinical people are moving to non-clinical jobs. So this again emphasizes that the scope is huge, and the value proposition also is huge. So this is something which every non-clinical person should think, that clinical is not important, non-clinical is more important, or it acts as an ecosystem. And if a healthcare doctor or a nurse is coming into the non-clinical, then it shows that how important these roles are, and how uh, these roles are evolving in terms of, not only in terms of roles, but also in terms of financial benefits and career paths as